Good morning, and welcome to the Virginia Interfaith Center for Public Policy's live weekly broadcast. I'm Roberta Oster, the Communications Director. Our show, Virginia Interfaith Live, brings you the latest news and resources from policy experts, faith leaders, legislators, and community members. And you are part of the broadcast. You can ask questions on Facebook during the show. During these challenging times dealing with COVID-19, our program focuses on economic, racial, social, and environmental justice issues here in Virginia. We will keep you up to date, and we will keep our elected officials accountable. We will also share opportunities for you to get involved in our work advancing social justice and helping our neighbors. Today, we will address a critical issue that's impacting people across Virginia and around the world, coping with mental health issues during the COVID-19 crisis. I am pleased to introduce our moderator, my colleague, Dora Muhammad, who is the Congregation Outreach Director for Virginia Interfaith Center. Dora?
Good morning and welcome. Thank you everyone for joining us online. We appreciate your support. I'm very excited about today's show. As she said, we're focusing on coping through this COVID pandemic. And I am thrilled to have with us today as our special guest, Reverend Dr. Cheryl Ivey Green. If you do not know her, she is indeed a powerhouse of spirituality, civic engagement, health equity advocacy. She serves as the executive minister at First Baptist Church of South Richmond, but she's also the immediate past president of the Baptist Ministers Conference of Richmond and Vicinity. Very, very powerful, did I tell you not? And for Black women who know her as a member of the Richmond chapter of the National Coalition of 100 Black Women, just phenomenal. With all her hats, the one today that we're sort of zeroed in on is her role as chair of the Richmond Behavioral Health Authority. Dr. Cheryl, would you like to say a few introductory words?
Well, good morning, Dora, and I want to thank you for allowing me to share with you on this afternoon. And truly, I have worn a lot of hats, and today I come as chair of the Richmond Behavioral Health Authority, but having served 2 terms with the Virginia State Board of Behavioral Health and Developmental Services. And so I'm hoping today that I can bring together all of the roles that I have had the blessed privilege of serving in to converge on this conversation about coping well during COVID-19.
Thank you so much. So one of the things, of course, the pandemic, has hit us as a public health crisis physically, but many are definitely saying that behavioral health is the second front line that we'll be facing if we're not currently facing it now. We're beginning to see some of it. Can you talk to us sort of about what's the importance about mental health? How does it relate to behavioral health? Is it the same thing? Is it just another word? So that people are clear when we talk about behavioral health, where mental health fits in that discussion.
So when we speak of mental health, we have to speak of being whole, mind, body, and soul. And so if the mind is not operating in a healthy fashion, the rest of the body is not going to follow. Now, the change in language from mental health to behavioral health really helps to address some of the stigma that sometimes comes when persons say they have mental health issues or they are struggling with the challenges of mental health. And hopefully we'll get to talk about that a little bit today, but they are both the same. But when we talk about behavioral health, it brings a level of comfort to the population that's being served.
Now, do you know of sort of the challenges or sort of the process of integrating mental health with all of the physical health? A lot of people focus on sort of, when we talk about access to health care, delivery of health care, the healthcare safety net. I know that the Richmond Behavioral Health Authority has an integrated model called RICH. It's for the Community Health Recovery Initiative. Can you talk about that and sort of why it's important to integrate, and sort of why, what challenges people have with integrating behavioral health into physical health initiatives?
So I think we do so well with the physical health initiatives, and you can look across the Commonwealth and across the country, and you can find lots of work being done, particularly in communities where there are health inequities. You can find a host of services for diabetes, for high blood pressure, and for many of the things we face physically. But with mental health, it's somewhat of a challenge, and I think the biggest challenge is helping those that we serve to understand how to access the services we provide. And you are absolutely right about RBHA. RBHA provides a host of mental health services: crisis intervention, substance abuse, case management, and just a number of services, pharmacy assistance. But when you are not informed and aware that these services are available right in your community, you won't be able to take or access. You won't be able to access the many services that these great health professionals are providing. And I cannot shout enough or cheerlead enough about the Richmond Behavioral Health Authority staff under the direction of Dr. John Lindstrom. They do an awesome job, and it did not just start with this pandemic.
Can you talk to us about sort of how you go about successfully and effectively raising awareness about the resources and how to access it? Indeed, I know when the COVID pandemic really started to take off, one of the very first resources that we put together here at Virginia Interfaith was a one-pager about how to access all these critical services, because you had so many people who before were not could be considered or consider themselves vulnerable populations. Mm-hmm. But because they were impacted, they had no idea how to get help with food, all of the basic necessities, childcare, health insurance, Medicaid, unemployment insurance. So we put together one pager that we distributed to all of our members and our faith congregations. So wondering sort of how you all are successful in meeting that need and making those necessary bridges to access.
So there are persons that are literally working around the clock to make sure that our services are available. But RBHA continues its operations. If you were to call RBHA 804-819-4000, the main line, you can access services that way. But I think that it's been a particular challenge for vulnerable communities. Mm-hmm. To be informed about the services available to them. Because when you think about those communities, many of them don't have access to technology to be able to hear and to receive information about the services that are available. But I mentioned several of the services earlier. They are available, but access is particularly difficult. And I think perhaps we might be able to do some things like provide those one-pagers at food banks, doctors' offices, places where people go to receive services in the community, grocery stores, the mom and pop shops on the corner. We may have to do some creative things to get that information out.
I definitely agree. One of the things that I came across in just looking for resources was one thing that the behavioral department had, and it was a map of Virginia that had all these different suggestions on ways to cope with COVID. I don't know if you all can put up the graphic, but it brought me back to, and I may be telling my age, when I was a child, there used to be Calgon commercials with a mother with all these different people calling her husband and the children, the dog barking, and she's like, Calgon, take me away. And that really is what is confronting a lot of families new for this first time, being overwhelmed, having your children home with you, having to figure out how to work from home, or maybe you can't work from home and you're an essential worker, and all these family stresses, financial stress, just the emotional weight of it all. even though these may seem like they're temporary realities, they likely will lead to some longer kind of damage. Can you share with us some keys that you suggest in maintaining wellness of mind as we try to cope with COVID?
Okay. And so I want to start with me because, you know, it is so easy to fall into that, whoa, it's me trap. But I made the decision last month, perhaps early last month. I was leaving a worship service, and literally it felt as if the Holy Spirit spoke to me and said, self-shelter. I'm diabetic, and so I do have that underlying condition, but I was outside of moving about on Sunday morning, probably out and about a little bit more than I should have. But the minute I made the decision to self-shelter, I knew that part of remaining healthy in this season is to establish a regular schedule. And so I want to suggest that persons establish a regular schedule. I get up in the morning, have meditation time, jump on a prayer call, and then at 7:30, I'm on a Zoom CrossFit class because I need to maintain my physical health. I finish that class and I do some prep for breakfast and put it on low, go up and shower, and I get dressed as if I'm going to the office. I get dressed, come down, and I am actually logged into the office by around 9. And I work. I do get up and walk on the hour. I just get up and move. And I want to suggest these things because it helps you with your mental health. I get up and move. I have my lunch, work for about another hour, and then I generally go into the church for about an hour, grab my mail, check any important issues that I need to work with. And then I meet my partner. I have a walking partner, and we walk every day. And so let me see if I can, put it in some simple terms. Establish a schedule. Establishing a schedule will help you to just stay in a regular rhythm. And then you are in control of the things that you think about. The mind is an amazing thing. And so you are in control of your thoughts. So when you begin to have those thoughts, those negative thoughts, you have to redirect your thoughts. And then, work on the things that you can control. There are so many things outside of our control. We can't control when the state's going to open. We can't control how long we're going to have to self-shelter or social distance, but we have to do many things for our own health. And then know that there are health officials ready to help you. There are spiritual officials. Almost every church has some level of grief counseling or counseling for depression. And then the other thing is reach out. Don't always stay in that place of isolation, but reach out to others. Make phone calls every week. I try to make at least 2 calls to somebody just to check and say, how are you doing? Even if it's by text. If I don't make a call, I text. And I think that that's so important because I think what's missing right now is our ability to connect with one another.
It is. And it actually leads people closer to the edge of not being able to cope. So, when we talk about one of the things that happened very early on in my community here in Northern Virginia, there was a local fireman who committed suicide, just dealing with the response rate, dealing with the emergencies. And of course, nationally, we've heard about the 2 healthcare workers. There was an ER doctor and an EMT in New York who committed suicide. Again, just deal with the emotional weight being on the front line. But you touched on something that was really important. There was it was about mid-April, a case of a young man in Richmond who came out of rehab and came back home and didn't have, because I love the idea when you're talking about having the walking buddy and still being able to still socially connect but still keeping physical distance, not having the physical space of his support groups. He really couldn't adjust to having the therapy online. He really needed the physical contact, he eventually committed suicide. And that story was very jarring because it really touched a point of the, even though so physical isolation seems to be a solution to protecting our physical health, on the balance of that, it actually can be very detrimental for people who need those physical lifelines. Can you talk so much about that? I know, just to put a few statistics out there, there was a Kaiser poll who said, it was in mid-April also, that said that half of Americans say that their mental health has been affected negatively by the pandemic. I don't see how not. And the Federal Emergency Crisis Line said that their numbers increased 1,000% for the month of April than it was for April of last year. And then there's the last one I want to point out is Talkspace, which is an online therapy. Again, it's an option, but not everyone's comfortable. They said that for the past 3 months, they've seen a 65% increase in their clients. So people are reaching out. But can you talk about sort of how can we, because you began to touch on it, but want to kind of stay here for a minute, and how do we reestablish or recreate lifelines for people who really need those kinds of encounters and cannot really adjust with recovery or maintaining their wellness online virtually?
Yes. And I thank you so much for bringing up that story about young Demetrius who committed suicide. I want to commend his mother. I don't know if she's watching, but things were going well after he came from those rehabs, came back home, decided that he needed to remain engaged with some sort of group therapy, connected with the McShin Foundation. Things were going well. They had a group session in someone's backyard. There were 30 of them, but because of the mandate to only have gatherings of 10, someone called the police, and so they had to disband their meeting. And it's cases like that where we look at law versus how we serve the people and how we find a way to offer them another alternative. And the challenge I see in this season of the pandemic is we were created to be in relationship. And so when we are not in relationship with one another, God created us to be in relationship. When we are not in relationship with each other, there is a real disconnect. And we, as those who are in the business of caring for people, have to put our listening ears on. I want to just use an example of a couple of weeks ago. I had a young lady call, and well, actually, she sent a group text out, and basically her message was, "I'm sinking. I'm not sure I can make it through this." It's being teacher and employee by day and needing space for herself, and then in the evenings not being able to disconnect from her children, and sometimes we make that a bad thing because we just need a little bit of space, but sometimes that connection can be made very quickly with a phone call. What I did was, everybody that was on the text, I said, "Can you get on a Zoom call in 15 minutes?" And everybody texts back, "Yes." And 10 minutes, I sent that Zoom link out, and we made a connection. So, when we make that connection, we have to make sure, as the spiritual counselor or as the friend, that we are not trying to be the behavioral health professional. But just by having a conversation, you can determine the needs and you can refer those persons. Fortunately, it was just a need of a desire to be able to talk to some adults and to make a connection with some adults. So I think the important thing is we have to make those connections. We need to know that people are grieving heavily. They need somebody to talk to about it. We've had many members who lost loved ones in New York, unable to attend the funeral, watching the news with all of those bodies lined up in those refrigerated trailers, and just having to cope the fact that I can't grieve in a way that I'm accustomed to grieving. So we have to find a way to make those connections and to be in relationship with one another. And this is a good thing that we sometimes have to do. Give ourselves a countdown. You know, if 2 days later you're still on the couch or you're still in that deep place of depression, pick up the phone and call somebody. Sometimes just the voice of somebody that sounds like they care makes all the difference in the world.
That's you have not said it any clearer. I grew up in New York. Most of my family is in New York. I stopped counting after 75 towards the end of April of people that I know who have died from COVID. So what you're saying is very real. At the beginning of what you were saying, you kind of put on one of your other hats that I want to touch on, and it's really speaking to those in position of faith leadership. So you also sit on the board of the Balm in Gilead. It's based in Richmond, but it's a global organization that really seeks to empower faith communities to really work towards removing the health disparities within the African American community and for all people of African descent. And so I wanted sort of to talk to you about, if you put on the Reverend Dr. hat now,
Okay.
and talk to me about sort of what role does faith communities and clergy leaders especially have to help remove the stigma of even reaching out, saying that you need help, and seeking help, and then seeking support for mental health resources?
So I want to speak to my colleagues first, because we are very guilty of giving great advice to everybody else and not receiving the advice ourselves. And with the number of people that we find ourselves ministering to, the number of funerals, graveside services, actually, that we're having to conduct, at some point, many of the deposits you made to strengthen yourself have been empty. But the thing I want to say in the faith community about our ability to address those issues is that we, first of all, we need to be systematic in the way that we address it in the faith community, and to help our parishioners understand that having behavioral health or mental health issues does not mean you're crazy. And that has been something that historically has been part of the African American community and underserved communities. The minute you say you need to see a counselor or you need to see a behavioral health professional, people label you as crazy. Part of the problem with stigmas, and Dr. Pernessa Seal, who is the CEO of the Balm in Gilead, addresses it so well in her book, Stand Up Stigma, is the fact that
yes,
some of those labels like crazy, we've been told, or children have been told that at a young age, or even adults carry that from their youth. Yeah, they carry that from their youth. And so we have to be careful about what we're bringing to the table that really labels folks and makes them feel like they can't come to us to receive services. And that's the change in the language from mental health to behavioral health, just to soften it so that persons feel, I'm not crazy, I just need some help sorting all of these things out that are going on in my mind. And sometimes when you you have so many responsibilities, particularly in this pandemic, your mind is racing. And so you need someone that can help you steady the course and to help you to know that you don't have to be labeled crazy. You don't have to be labeled as someone that no one wants to be around. But there are services to help address that. Not only services, but there's medication. And to the folks that don't like taking a whole lot of medication, I don't either. But every now and then you have to have a little something, or else it turns into something that creates a substance abuse issue for you. And that's one of the things I think we're dealing with in this pandemic is the increase in the alcohol intake level of many people, because they're looking for other sources to try to soothe what's going on in the inside. But nothing takes the place of that, but you're addressing the issue at hand. I hope that.
Do you think the stigma? It does. It definitely. And I like the fact that you spoke to faith leaders first, because I almost feel like we need to have like a international intercessory prayer team for our faith leaders. Many of our board members here at Virginia Interfaith are clergy leaders, and immediately you felt like just the weight on them in trying to be shepherds and faithful shepherds at this time. And so we prayed for our clergy members that were on our board. But I was wondering, do you think that stigma impacts the limited level of investments from a policy standpoint, from funding from the government level, when it deals with funding actual mental health services? I know that for COVID, Virginia recently received a $2 million grant from the federal level, mm-hmm. and it's specifically targeted for community service boards, which have been neglected for so long, but they're prioritizing that funding for community service boards. And if people don't know, every county in Virginia has a community service board. Do you think that stigma affects our policymakers and our legislators on the local and state level?
So I don't think it's stigma with those who are making policy. I think that it's a lack of understanding of the importance of mental health, that it impacts every aspect of your life. And so I said this earlier, when the mind is not healthy, the body and everything else is not going to follow. And there are going to be other underlying issues because the mind isn't working, because persons suffering from behavioral health issues, sometimes can't think to take care of themselves. But I think that the policy issue here is that so often the policymakers have been reactive as opposed to proactive. And it takes me back to, Virginia Tech. We reacted, more dollars were put in place. And then when things seem to be leveling out, we pull away from that. The issue with Senator Creedy's son, reactive. When things settle out, we kind of move on with life as usual. But I want to really give a shout out to the advocacy committee of Richmond Behavioral Health Authority for helping, and those in the Virginia Community Services Board and all of the community services boards for actively advocating for rights and resources for those who need the services of the behavioral health community. As I think about this grant that was received, it is to help increase the capacity of CSBs. But, this is a limited amount of money. It's not going to take us forever. And the greater needs are going to come after we come out of this pandemic. I believe we're going to have even more persons needing behavioral health services. And so while that grant is great and we're excited to receive it and to be a part of it, we need more resources. And the unfortunate thing is, because cities and counties around the state are having to use dollars they had not expected to use for COVID-19, much of the money for behavioral health services will either remain flat or possibly suffer some level of decrease. And that concerns me. That really concerns me as an advocate.
It definitely concerns me. So I don't know what policymakers or legislators are tuning in or will watch this video. Please take note. It is definitely something that I've discussed as sort of manager of our health equity program here at Virginia Interfaith with our policy director and our executive director, that we need to really just keep that on our radar to see coming out of COVID during the recovery period, what resources we do need to advocate for, because it is absolutely correct how you framed it, that we need to be proactive. And I do want to mention, just as a footnote, after Senator Deed's son, that incident happened in 2013, there was a commission to study set up, and it's gotten extensions. But I just think we need to do more. We definitely need to do more and be very, very proactive. So Virginia Interfaith Center will definitely be a part of working for those proactive solutions through policy changes. So before we go, I would like to ask if you can share a message, sort of putting all of your beautiful hats that you wear so well, and just deliver a message of hope, for anyone who's tuning in, or who may view this video later, that are really dealing and struggling with the emotional weight of COVID. Can you please just share a message of hope that will help them?
Okay. So the first thing I want to say is hang in there. God is your very present help. This morning when I got up to do my morning meditation, my meditation was about God's presence. And sometimes I think we lose sight of the fact of this 24-hour, 7-day-a-week available resource who wants to hear from us just in our prayer time. And when we connect with God, God allows us to connect with others because he places us on the hearts of other people. But as I think about this season of the pandemic, I think that the question that all of us need to ask those who are searching and seeking and struggling is a word that's found in the 5th chapter of the Gospel of John, the man at the pool at Bethesda who had been there for 38 long years. And, when the Lord asked him, do you want to be made well? He said, every time I try to get in the pool, somebody gets in ahead of me. But the relevant question for everyone that's struggling with any level of behavioral health challenge is, do you want to be made well? But somebody needs to be asking that question. And when we ask that question, we need to be able to point them in a direction to receive services and to know that they can be made well, they can be made whole again. And so I want to encourage anyone who's listening and who is struggling during this season of the pandemic. I want to share with you that you can be made well. And somebody out there needs to ask the question, do you want to be made well? That's how we can cope well in this season of COVID-19. And it also allows us to make that connection. Don't lose sight of the many who are out there who are struggling because you are so safe and you are so comfortable in your own home. You have not had to deal with being furloughed. You have not had to deal with standing or in line at a food bank that's miles long. You are not having to teach children all day and work at the same time. But there are those who need to hear us ask, every one of us, do you want to be made well? And then we have to point them in the direction of wholeness.
Thank you so much. That was so beautiful. And I hope everyone who tuned in today got something out of our conversation. I know I did. It was wonderful. Thank you for sharing your time, Dr. Cheryl. Appreciate you and all of your hard work, and the team at Richmond Behavioral Health Authority and all of those involved in behavioral health in Virginia. Your contribution to making us safe and whole goes without saying. It's value, it's immense. So as always, I'll say stay informed, stay inspired, and stay connected. Thank you all. Have a good afternoon.
Thank you.